But anyway, this meant that she missed her physical therapy, which she desperately needed, for about 2 or 3 days. She would, according to the note that accompanied her from Newton Wellesley to Sherrill House, she was supposed to get a great deal of active physical therapy. And here she missed it for several days. But anyway, then they started the physical therapy, and they had to be very careful with it because she fatigued so easily and her heart rate would accelerate, etc. So, but the people doing it were young, nice, good people, and they worked on her, and this helped as we stayed at the house as she was getting a little stronger and so on. But she never got into a position where she could walk from her room maybe, not too many yards down to the place where she could sit at a table and eat. Maybe she always went down there in a wheelchair in the whole course of the time that we were there, and she only did that for the last few days, mind you. Up to that time, the meals had been brought to her, and now and again she'd been allowed to sit in a chair and get out of bed and so on. But in other words, she was really physically very weak and needed physical therapy. Incidentally, when they do physical therapy, I don't know why you can't be recovering on weekends as well. It seems ridiculous that you're spending all this money to be in a nursing home and not getting the treatment that you need on 2 days a week. But anyway, this is our crazy system. And the paper sending her to, from Newton Wellesley, sending her to Sherrill House, said that she should be there for 30 days. Actually, on about the 26th day, the doctor, who was a very self-possessed person, mind you, said, well, she can go home. And I said, this is ridiculous. There are 10 steps to getting up into our house. She can't get up and walk around and toilet herself. It's absurd to send her home. He said, oh, no. According to law, if I kept her, I could be prosecuted. She's only been qualified for a short time and so on. Actually, she'd been qualified for 30 days. He kept her there 28 days. And then she sent home. And then even sending her home was a mess because when they ordered the wheelchair, they didn't fill out the blank in the wheelchair telling them what time it was supposed to come. So she was all ready to leave about 11 o'clock in the morning, sitting in a wheelchair that belonged to the nursing home, waiting for this wheelchair to arrive, and it arrived maybe about 4:30, and the reason was they hadn't filled out the form properly. And by this time, of course, she was very fatigued and so on. And on the way home, we had to stop and pick up some medications, and we had to stop and buy some applesauce because she had trouble swallowing pills, and she needed the applesauce to help get crushed pills down into her stomach where they could do her some good. But anyway, so even leaving the nursing home was ridiculous. Incidentally, she had a cough at the nursing home, which my daughter-in-law, who was the doctor who had just arrived in town from Cleveland for a couple of days, noted. But anyway, they sent her home, and 5 days after and when she got home, she was supposed to get physical therapy. He didn't arrive on schedule as he was supposed to. As the visiting nurse arrived only a couple of times, and the second time she arrived, she decided Eleanor had to go back to the hospital for treatment because Eleanor at that point, this is 5 days after leaving Sherrill House, had a urine infection, she had MRSA, she was dehydrated, and she had pneumonia, which of course shouldn't have occurred. They should have caught it. They shouldn't have discharged her with a cough, and they should have tried to treat the MRSA while she was still at the nursing home, it seems to me, because the fact that she had MRSA meant that we kind of discouraged visitors from visiting her, and they would have been a tremendous moral factor for her. She was a very people-oriented person. But anyway, so then we went back to Newton Wellesley Hospital were there for a few days, and she was feeling better. Now, in Newton Wellesley Hospital, for the first time in the hospital records, and I found all the records from the hospitals and the nursing homes, they mentioned that she was somewhat depressed. And she was depressed at this point. After all she'd been through, here she was back in the hospital. And this was a vital factor in the decline that followed from this period of time. Anyway, after she was in the hospital for maybe 5 days or so, they sent her to another nursing home, Sherrill House, which was closer to Wellesley, but it's not a good facility. It's not terribly clean, it's congested, the air conditioning isn't great, and the food was terrible in this place. But anyway, it was close by, and they sent her there, and a nurse in Newton Wellesley said to me, "Oh, that'll be good because they have good physical therapy there. I used to work there." When we got there, we were not impressed with the physical therapy, which was largely absent, etc. But so they put her in a room in Sherrill House in the long-term section instead of the short-term section. This itself is a terribly discouraging factor. There are people there kind of falling out of their wheelchairs who were incontinent and things of this sort. They put her in a room that was very dark because the other patient in there who was near the window liked it dark and had been a long-term patient there. And the room was too warm. After I complained, they did produce another window air conditioner, which helped somewhat, but not greatly.